So the research came about from just almost a sense within the hospital that those patients who weren't as fit just didn't do as well following surgery. It was almost anecdotal rather than systematic. And so a decision was made to look at the data more systematically and to examine the impact of chemotherapy as well. So we examined aerobic fitness in patients undergoing chemotherapy and major surgery for the treatment of upper gastrointestinal cancer, predominantly stomach and esophageal. So the research entailed having all patients undergoing the patient pathway for treatment for this type of cancer, undergoing incremental exercise tests both before and after their chemotherapy, both prior to surgery. The findings showed that two things really. First, that aerobic fitness prior to chemotherapy was related to outcome as measured mainly by survival in days after the major surgery. And secondly, that chemotherapy resulted in significant reductions in aerobic fitness. So in a wider sense, the impact of this research suggests that one, any patient undergoing major surgery, their fitness should be optimised or maximised to maximise their survival. And two, any patient undergoing treatment for chemotherapy, there is the chance that some patients may have their aerobic fitness reduced to such an extent that their survival following surgery is jeopardised, and in such cases you may even consider not having such patients undergo chemotherapy prior to surgery. So the research was undertaken at Aintree Hospital, and it was in collaboration with some others in Southampton at UCL. And it is gaining some traction, but I think part of it is just time to get the research out there. But now we are starting to look at ways of maximising fitness. So first of all, just looking at training in patients before they go to their surgery, and the next step will be to look at the best ways to maximise training in quite a small period of time to maximise their aerobic fitness in the period between the end of their chemotherapy and when they have their surgery, or even have undergone training when they are undergoing their chemotherapy. So because this data is so new and the data is so novel, it will take some time, I think, for it to filter across the wider NHS and be a practice to maximise fitness in these type of patients before surgery.